Today is April 26th, 2023. Quick disclaimer, I'm not a medical professional and I'm not giving medical advice in this video. However, I will say this: if you experience any changes or issues with your vision, with your eyesight, whether it's seeing little floaters or whether you have a loss of vision detail up close or at a distance, or if one eye is viewing the world darker than the other eye, see a medical doctor immediately, because you may be experiencing a medical emergency. And that's exactly what happened to me 6 months ago in October. I woke up one morning and looking out of my left eye, everything was darker than out of my right eye. Plus, I was seeing all these little floaters when I looked out. I had experienced a severe vitreous hemorrhage and multiple tears to my retina. I needed emergency laser surgery, which initially was a success. By mid-December, approximately 2 months after the surgery, I had about 90% of my vision back. However, as I moved into January, I started developing a layer of scar tissue over the retina, and that layer became thicker and thicker. And the thicker that layer of scar tissue became, the more my vision deteriorated. So by early April, my vision was very compromised. I'm not able to see any detail up close or at a distance. I can't see straight lines. Everything is very wavy. The color's a little off. The left eye sees things a little smaller than the right eye. So I needed vitrectomy surgery to take care of what's called a macular pucker. That's when that scar tissue forms and it warps the back of the interior of the eye, the retina area. So I arrived at the hospital this morning at 7:30 a.m. The surgery lasted from 9:45 a.m. until 11 a.m., approximately an hour and 15 minutes. The first 10 minutes in the operating room, I was anesthetized. I was put to sleep while they applied the local anesthesia to my left eye area. The vitrectomy is an invasive surgery to the sphere of the eye. 2 long needles are speared into the eye, and a third needle is also in the eye. So the eyeball itself has these 3 needles pierced in it. One of the needles has a light on it, the other needle has a pincers on it, and the third needle is called the trocar, I guess is for drainage. So I was out for 10 minutes, and when I awakened, the eye surgeon began the surgery. The surgery was not very painful at all. There were a few moments of discomfort. I was awake, very clear-headed during the entire surgery, other than that first 10 minutes of being out cold. And with my left eye, I could see kind of in a shadowy way what was going on inside my eye. I could see the gel, the vitreous gel, being sucked out of the eye. I could see the eye surgeon using the pincers to pull back all of that scar tissue, and I had a lot of scar tissue. He said my case was one of the 2 or 3 worst he'd seen. So I had a lot of scar tissue, and I could see there was dye being injected in my eye, so the surgeon can visualize where the rods and cones are and where the scar tissue starts. After he had removed that scar tissue, he noticed that there were some additional retinal tears. So at that time, he used a laser to laser weld those retinal tears. So after the surgery, I was wheeled out into a waiting room. I waited. They wanted to make sure my vital signs were fine. I waited about 15-20 minutes, and then I was released from the hospital. And again, that was earlier today, approximately 6.5 hours ago. So I'm feeling good now. There's not a lot of pain. The doctor, during the surgery, he did inject a gas bubble, and in my case, the gas bubble will be absorbed by the eye in approximately 7 to 10 days. People who have a completely detached retina, that gas bubble in the eye may be in the eye for a number of weeks, and their recovery may be 6 to 8 weeks, where they may have to be face down because the back of my eye, the retina had already been laser welded back in October. My retina was not totally detached. There were a few additional tears there. However, I don't. My recovery period, at least the bubble, will be in there about 7 to 10 days, and the recovery time frame is going to be anywhere from 2 weeks to 6 months. The doctor is hoping that about 50% of my eyesight can be restored in this left eye, which would be great because right now it's in bad shape. So hopefully this surgery has will help restore my vision. Thank you for watching.